Good morning, everyone. Good morning, everyone. So, what a difference a day makes. Good morning, I'm Steve Clemons. I'm Washington editor-at-large of The Atlantic. It's a pleasure to be here with an outstanding panel that has grown dramatically in the last 24 hours because just about this time yesterday, a decision came down on the Supreme Court that has resulted in the title of the session today, the Supreme's latest hit, The Affordable Care Act Survives Another Test. That title is all due to Britta Stevenson here at the Aspen Institute, so thank you, Britta. But we have a lot of issues. I was talking to Tom Daschle a moment ago about really which direction we should take this, and he said it really ought to be the What's Next panel. We have so many things. So we had a decision, which we're going to discuss in a moment, but it answers as many, it raises as many questions about what are now the next layers of questions of undone responsibilities in the healthcare arena, things that aren't part of this, kinks in the system. And let me tell you who we have here to discuss this. We're going to have a conversation, and we're going to leave plenty of time, although we've chewed up a bit of it, with all the excitement of all of this, to involve as many of you as we can in the discussion as well. But just to my right, of course, we have the just over PTSD, former Secretary of Health and Human Services, former Governor of Kansas, Kathleen Sebelius. We have a couple of Senate Majority Leaders here. Bill Frist, of course, Senator Bill Frist, who is also a surgeon, heart surgeon, saved people in the Capitol. I'll never forget the day in which he actually went to work and showed the world what he could do beyond legislating, so it was quite fantastic. And Nancy Ann DeParle, of course, who is both Deputy Chief of Staff in the White House, but was the Director of Health Policy for 2 years during the period when the Affordable Care Act was passed. It was really one of the, with Kathleen and others here, one of the primary architects. And of course, Senator Tom Daschle, another Senator Majority Leader, part of the Obama franchises. He was a health czar, we could call that at one point in this, and has written extensively about health reform in all dimensions, made this one of his own legacy elements in his congressional career, as did Henry Waxman. Henry, who has just stepped out of Congress, has just retired from Congress, chaired the House Energy Committee as well as the House Government Oversight Committee, and has authored so much legislation that passed over decades in the health policy debate that he too is part of the thing. So I've told Bill Frist that if there was one person who stood out, there was not the other. He may be it. So he's going to have to work a little bit harder here today. But I wanted to start perhaps with Kathleen to give us just a quick snapshot, headline zingers of what the decision yesterday did do and what it left undone.
Well, the decision in the King v. Burwell case was really about 4 words that are in the statute and whether or not they should be the prevailing words in the statute. And those 4 words are established by the state. King, the plaintiff, suggested that those 4 words should be interpreted to mean that only individuals who were in an exchange established by the state should be entitled to tax subsidies. No one else should be entitled. So there are 34 states that actually use the federal marketplace as their method of enrolling and engaging in the Affordable Care Act. 17 states have their own state marketplaces. So what was at stake really was 34 states, 6.4 million people in those 34 states who have subsidized insurance policies. And if the court had indeed ruled for the plaintiffs, they would be subject to losing the subsidies, which made their insurance affordable, consequently losing their insurance. But well beyond that, as if that wasn't dramatic enough, that people who have had insurance coverage for a couple of years could lose it, and then they and their families would become once again uninsured. The entire individual insurance market in those states, the rules for the Affordable Care Act, have one large risk pool. So even if you weren't in the marketplace, if you were an individual in Alabama or in Kansas or in Texas who purchased your own health insurance in the individual market, those customers dropping out of the market suddenly would mean that rates would skyrocket. You suddenly would have a very unbalanced risk pool, and it's exactly what the individual market used to look like, where rates went up each year. Younger and healthier people dropped out of the market, older and sicker people stayed in the market, and the individual market was on a slow death spiral. This would be a very rapid death spiral in those 34 states. So it had a lot of economic consequences. certainly a lot of individual consequences, a lot of consequences for hospitals and doctors who now counted on that payment system, and a lot of consequences for insurance companies who for 2 years have been in that competitive market and suddenly would be looking at a very dangerous and precarious financial situation. So there was a lot at stake. John Roberts, Chief Justice, wrote for the majority in the 6-3 decision. And he basically said, you need to look at what Congress intended. Congress intended to help fix the insurance markets, not destroy the insurance markets. You have to read the case in its entirety. And I would say it's the strongest possible decision. They could have said, we're only deferring, we're using the Chevron deferral. We're letting the ruling of the IRS, the administrative ruling, stand, which would mean that in subsequent administrations, a new IRS could say, well, we see this very differently.
So this is definitive.
This is definitive. They said this is what the law says, and it is constitutional.
Let me quote, I sort of collect beautiful prose that's snarky yet that praises something. And Bill Frist has something that would go in my Hall of Fame that he apparently wrote last night. So I'm going to read Bill Frist's line here. It says, the Affordable Care Act with today's decision settles firmly and securely into institutional and cultural permanence. Obamacare graduates now from political toy to the policy stature of Medicare and Medicaid. The decision signals that Obamacare grows up and now becomes the Affordable Care Act. It is woefully imperfect because of the miserable way it was initially written and passed, but after 5 years, the new certainty for insurance markets will permit ... So Bill, I'd love to get, I just, really, you should write for us.
Henry Waxman.
I think it's terrific.
Can hear you, and he helped
give
to
us a
write it.
snapshot of what you saw as the stakes of yesterday's decision. And how, were you surprised at the robustness of the decision?
I think Kathleen summarized it very well, and the one-liner from Justice Roberts will be the one that we come back to in terms of insurance markets intent, and that we really are all in this to bolster insurance markets, and I think he captured it. Captured it better than the legislation and the law actually did initially. I look at it pretty simply. We have the reality of what the implications of yesterday are. Then we have the politics. What are the implications for the future of the elections from a political standpoint, the world that many of us have come from, and then the substantive policy end of it. And those are sort of the three buckets a simple surgeon thinks in. The reality is it changes nothing. The 6 million people aren't going to lose their insurance. No law has been changed. The law is out there. It passed yesterday. We'll forget it by later today. The reality, think about it. That's right. So that, which is a good thing, because as Kathleen says, and as I mentioned in my piece, or it may have been in that part, it brings an element of certainty that political figures who are answering not just to principle and sort of do the right thing, but also to what the people are thinking and feeling who don't like Obamacare for the most part. It gets more certainty. And then the substance it opens up, there are things we need to fix that we can come back to as we talk, that I think is really important. So the reality is no change. The political end of it is big because it says the courts are no longer going to be the battlefield. It's going to be in the political arena. And on the substance, we have some great things to be done, but it's going to require all of us working together, and that's going to require a new president of the United States in the next election.
So before I leave you, just about everybody you used to work with is running for president.
Yes.
So, So what would be your counsel, outside counsel to them? Because this now affects the political terrain, particularly if you're a GOP contender.
Yeah, and it really comes back, the Kaiser Family Foundation, I'm on the board of that, just disclaimer, but 42% of people as of today don't like it, 39% do. And if you're trying to fix something, if there's uncertainty out there, you can hide behind this sort of vague, well, a lot of people don't like it. The fact we have more certainty today, because the courts are out of it now. There'll be some little court decisions, but it's no longer in the courts. It's in the politics and the substance of it. Now, our elected leaders, coming back to the presidency, is going to have to come out and say, we're going to work together to fix this. It was passed in a partisan way. Blame Republicans as much as Democrats. Well, whenever you pass an unpopular piece of legislation in a partisan way, whenever there's difficulty, people run from it and say, those guys did it, we didn't. There have been 2 elections, there's going to be a third, and most of the people elected, the new people, were elected not liking Obamacare. Why? Because most people don't like Obamacare. That sort of cloud out there means it's going to stay a political issue out there. It's intimate. It's going to affect, healthcare is going to affect everybody in you. Your healthcare costs are going to go up. So it's going to stay a political issue. The answer, I think, is the president, it needs to, whoever it's going to be, is going to have to come after the election and basically say, we've got to bring people together. The Republican, in all likelihood, is going to, be still out there opposing, maybe repealing and changing. It's going to be incumbent upon them to be very specific of how they're going to replace it, or the American people aren't going to buy it. And the Democratic leaders are going to have to say there's some difficult things in there, because remember, most people don't like it. Democrats may love it, but most people don't like it. They're going to have to come out and say there's some bad things in there we need to fix, and we need to come together to fix it. I think a lot of it is going to come down to the state level in terms of where the focus, the political action is going to be. Now that some of the uncertainty, the judicial element has been removed, I think that is going to empower a lot of people who were against exchanges, against Medicaid expansion. All of a sudden, with the uncertainty, the permanence established, that it has reached the stature of Medicare, Medicaid, will have some confidence in coming to the table and actually fixing things.
Before I jump to Nancy, let me ask Tom and Bill to say, what do you think Mitch McConnell's next move are? And I'm going to ask Henry, what do you think John Boehner's next move is?
You want to jump in?
Well, I think Mitch is probably still going to be under pressure from a lot of his far right, the presidential candidates in particular, to schedule at least one more repeal vote. They're going to want to make yet another statement, not because they think it's good politically in November of 2016, but it's good politically for their base. They want to keep their base energized, and they use this legislation as the way to do that. In the longer term, I don't think that's going to work. And if I were McConnell, I would work on those things that actually might bring Democrats and Republicans together. We saw it already with the sustainable growth rate, brought a huge vote together. We saw it with the extension of the community health centers. We saw it in the House with 21st Century Cures. So there are elements.
Recent things.
All recent things.
Optimistic.
And I think what the American people really want to see is Congress working together. And they're not going to work together right now on the ACA, but there are a lot of parts. There's a lot of bipartisan agreement on payment reform and the need to move away from fee-for-service.
Right.
There's a lot of agreement on transparency, the need for greater transparency than what we have today. I think there's a lot of interest in changing the way we deliver care.
And you both generally agree on that, right? You and Bill?
And
No,
so
we don't agree. No.
Just wanted to kick the
Yeah,
tires. Yeah.
No, I think and I'll be quiet, but there's a lot of optimism. What Tom just said, the SGR, which you tried to fix as leader, I tried to fix as leader. We couldn't do it, and we had people working together. And now you have this hot partisan bimodal Congress, and they came out and fixed 2 months ago in a bipartisan way, huge health care bill, which is a little element of optimism in Congress. And you mentioned faster cures and others as well.
yeah, with a stop to payment reform as well. I mean, in that bill.
Yeah.
It's so. My point, I guess, is that once you get beyond this emotional debate about ACA or Obamacare, it's amazing how many things out there might have the potential for some reasonable dialogue and some consensus.
Henry?
Your question to me was what John Boehner would do. Well, we voted over 50 times in the House of Representatives to repeal the law. So I guess they could vote another time to repeal the law. Nancy and Ann and I were talking about whether the Senate ever had such a vote. Maybe McConnell will put that to a vote, and everybody can then say, I voted to repeal the law, I have no responsibility for it. Then we all move on. Now, the Republicans dodged a bullet yesterday, because in those red states, they would have had to figure out what to do with the middle class who now had health insurance. The opinion polls showed that most Americans did not want the court to go the other way. In the past, Obamacare is an abstraction. Many seniors came up to me and said, I don't want Obamacare. I don't want government health care. I want my Medicare. Leave it alone. It was all an abstraction. But yesterday's decision, had it gone the other way, would no longer have been an abstraction. People, through no fault of their own, who finally had insurance, would no longer have that insurance. So the Republicans can express their opposition, and we can move on to areas where we could get bipartisan support. And I am encouraged that the Congress is now moving in a more bipartisan way in the health arena. And I do not think it's because I left.
I just got a quick lesson from Nancy Ann and Kathleen over breakfast about what the costs of repeal would be. And on June 19th, a report came out from the new, shiny, Republican-supported director of the Congressional Budget Office, who brought that very uncomfortable notion that even with dynamic scoring, the cost of repeal would be about $137 billion. Without dynamic scoring, $353 billion. Nancy Ann, how does that impact the debate? Because that's not an overexposed data point. So
No.
that
was
must
last week's
raise the
announcement.
stakes, the burden of those people who are advocates of repeal, because it changes the game. I mean, because at the same time, you've got the Grover Norquist crowd out there not saying you want to pay, find new ways to pay for things or raise taxes to pay for things. But wouldn't that result in that if there was a successful repeal?
Well, it has a huge impact, and CBO both said up to $400 billion. And that doesn't even take account of some of the reforms that they assume would continue, that have made changes to the way that healthcare is delivered and are reducing costs. So even with that, it's $400 billion. It would knock 19 million people off of coverage. It hugely changes the debate, I think, and the question about what does Senator McConnell do, because he's had a team of people working on how to repeal the law using reconciliation, so that he would only have to have 50 votes in the Senate to do that. You have to use reconciliation. You have to be able to show a budget impact that you reduce the deficit. This is not going to reduce the deficit. So I think it does, lend credence to what Tom suggested, which is that if I were Mitch McConnell, and I think Tom's suggesting this too, I would just take a simple repeal vote and move on and get on to things that you can work on that are more progressive and positive. But I think it also says one of the most irritating criticisms of the law to me is that it didn't have any impact on costs. And I see people like Sister Carol Keehan sitting in the audience, who is working with hundreds of Catholic hospitals across the country, and I think she can tell us that it had an impact on costs. They had to rein in their costs considerably. The CBO's analysis certainly underscores that. This law is beginning to bring down costs, beginning to do some of the right things in improving quality. So repealing it would be the wrong step.
Go ahead,
Just
Kathleen.
to follow up on that, I think Nancy Ann's absolutely right. The mantra is, this is busting budgets, costs are out of control. We have had the lowest health inflation in 50 years, ever. The lowest sustained health inflation, and that's not just individual insurance prices going up at a slower pace. It's overall healthcare costs, it's private employer costs, we are finally in the ballpark of starting to trend relatively near GDP with health inflation. It used to be double GDP. It has come down, and it has, the first couple of years people said, oh, it's all about the recession, it won't last. It's now been 5 years, and it continues to trend in a very positive
Kathleen,
direction. Drug prices are alarming.
How much, every other country has seen the flattening of cost and spending, and there's huge debate, how much is structural, how much of it is recession, and I've kind of come out that half of it's recession and half of it's structural, because there's huge structural reform going on. How much of first of all, the cost savings, if you repealed Obamacare, because with all the tax increases, they go with the repeal, so of course it's going to cost a fortune. And I'm not a repeal person. I don't think a lot of substantive thinking recognizes just repeal for the reasons that Henry said. Unless you have an alternative that's compared to the Affordable Care Act as we know it today, not in the pre-ACA world, but today. The ACA world has become the standard. It's institutionalized. It's culturally there. It's not popular. So the repeal vote, you say, how could these crazy Republicans take this to another vote to repeal it when it's so impractical, remember the American people do not like this bill. There are more people who regard it unfavorably than favorably, and if you're a politician who wants to get elected and be a great leader, it's not crazy.
Is there a cruise care out there or something?
Yeah, where's the alternative?
Where's
the alternative?
I think that's the point. That's Henry's point,
Yeah.
that unless you put an alternative on the table.
Right.
And that's,
Well, they have
that's
an
the sig-
alternative. They've always said just run a large risk pool. Just go back to the old
Yeah, but
days,
that's
put
not-
everybody who's sick. That's the Republican alternative, and it's been
I'm just going to say,
suggested over and over
I
again.
think what people are doing is they're listening to their political leadership. If you're a Democrat, you're going to listen to your Democratic leadership. If you're a Republican, you're going to listen to everybody from Mitch McConnell on down saying how bad it is, and you're going to say, well, they say it's bad. But then you ask them, well, what do you think about the fact that you can't ever be dropped again? Oh, I love that. What about the fact that your children can sign up to your parents' plan? Oh, I love that. That's in there too? What about expanding Medicaid to people that otherwise could never have any access to insurance? I love that. So we're talking about the Affordable Care Act, you know. Well, I don't care what it's called. I love those things. I just don't like the Affordable Care Act.
Well, and if you call it Obamacare,
Yeah,
it goes down even
that's
more, right?
But I think that's it. I think
What
it's
don't you like? I don't
I
like
think
the
it's
Obama
really,
part of Obama.
it's
Right.
not
Let me ask
real for
before-
a lot of these
Right.
people until you can tell them what the bill does.
Somewhere along the line, despite the propaganda words that people use in talking about this issue, there ought to be an examination of the facts.
Oh, Henry.
One of the objectives,
Henry.
one of the objectives of the law was to reduce the number of uninsured. That's happened dramatically. The second objective was to reform the health care system by all the incentives to change from pay for quantity to pay for quality, to hold down costs by making health care more efficient. We were told more by the Republican leaders in the House, so I won't blame these Senator Frist, but we were told more people will lose their health insurance if Obamacare is continued. Not true. More people will lose their jobs. Not true. It will break the budget. That wasn't true. So at some point, people have to evaluate what has happened with this law. And I think by any measure, it has been a great success. Now, the Republicans can say, Obamacare, we hate it. But as Tom Daschle said, you go through all the parts of it, and now it's a reality for millions of people. I think they're going to start thinking that perhaps when they hear the mantra, this is a terrible thing that's happened, people are going to just say, well, yeah, I don't like Obamacare, but things are happening in the right direction. So somewhere before elections, you would hope that people would look at what the reality is, not just the propaganda.
I think just on the cost issue, because I don't know if we're going to come back to it, I think we have to be very careful in two things. First of all, we have had this flattening in spending, and the policymakers, and everybody here at Aspen, we can talk about that. And I think it is important. Other countries have seen it. And again, there's lots of Republicans, you know, say don't pay attention to it, and others will say Obamacare has caused it all to flatten, saving you so much money. The truth is somewhere in between, but I think we have to be very careful because from a policy standpoint, we have seen a flattening of spending. It will increase over time. Probably half of it's structural, of which Obamacare is part of it, but the private sector and capitalism and markets and competition and innovation and creativity, which are outside of Obamacare, are part as well. But if you do look at the last...
There's enough competition and innovation, or could there be more?
A lot more with the transparency. You know, Obamacare and the Affordable Care Act worked in that regard. We need a whole lot more. Yesterday's decision where you are, when a patient walks into a surgical care clinic or sees a doctor and they're bringing money with them, which is what Obamacare does through a subsidy and insurance, you have more transparency possible in pricing. You don't have as much cost shifting going on where you have to, you know, tax the insured people and charge them a lot more than the uninsured. And that's a good thing. There's transparency, but we need a lot more of that. But on the cost issue, just let me close on it real quick. If you look at the last 4 quarters, because we can't be complacent about that, the individual has seen almost a doubling of the % increase compared to last year each quarter. And Drew Altman in the Wall Street Journal has a great chart there, so just watch out what we're saying about that because costs are exploding. With deductibles so high, more skin in the game, our out-of-pocket expenditures are skyrocketing. The cost issue is something we have to address, and in fixing Obamacare, at whatever fixing it means, and in the new legislation, cost is going to be the issue out there, and that's what the individual is going to feel. As their costs go up personally, they don't care that we say as policymakers there's a flattening in spending, because they're paying more for what they were getting 5 years ago and 10 years ago, and that's a problem.
Let me ask Nancy Ann and Kathleen for a minute something, and I want you to pretend that we do not have 1,000 people in the room and that this is a small confessional just of us. And share with us, now that the Supreme Court decision has made this definitive, that we've gone from toy to the Affordable Care Act a la Bill Frist, that this is around, can you tell us what you got wrong? What wasn't in the Affordable Care Act that should have been? What are the reflective things that now that we've had a little bit, 5 years of history, do you wish had been part of this package that weren't been? I want then to ask everyone in just a few short form minutes, because I want to go to the audience, what are the 2 or 3 things that are the what next things that we need to fix now? What should be that agenda? Nancy Ann?
Well, from my perspective, I've thought about this a lot, and the one thing I would change would be to have had some Republican support for it. And we did everything we could. I spent hundreds of hours personally. The president spent a lot of time meeting with Republicans. Senator Chairman Baucus and his team, the law was famously delayed in the summer of 2009. Couldn't be marked up in part because he was spending so much time trying to get Republican support. And while that was extremely annoying and frustrating at the time we were going through it, not a day has gone by since the law passed that I haven't wished we'd had Republican support. That would have made all the difference. We might have still had, attorneys general in various states bringing lawsuits, but it would not have been nearly as ugly as it's been, and we would have been able to address some of the problems that needed to be addressed as
What
time
are some
went
of
on.
those? What would be your list of 2 or 3 things that need to be tackled now?
I don't know that I have a list of 2 or 3 things, but there are areas where, well, this language, the established by the state, if someone really thought that was a problem. I mean, I'll tell you a story. So after we passed the law, about a week after the president signed it, I called together our big team at the White House and HHS and labor, and I said, everyone bring your list of technicals. So we had a big stack of things that they would fix. I don't think this was in there because no one thought it was an issue, the established by the state. And one of the guys from our legislative affairs office came in to the meeting, and we were walking through each issue, and he goes, what are you doing? And I said, well, we're getting ready for the technicals bill, because there'll be a technicals bill, right? I'm looking at you, there always is after a big bill passes. And he looked at me and goes, you don't get it, do you? They're not going to allow us to make these kind of changes. I kept the list because I kept thinking eventually we'll all sit down and we'll go through and work on these things together. After the Medicare Modernization Act passed with the prescription drug benefit that many Democrats opposed, there still was, a technicals bill. There still was an effort to work together, and I expected that. And that's, I think, the thing that we mainly we failed at. If there was something we could have done, I wish I'd done
Kathleen?
it.
Well, I don't disagree with Nancy Ann that was a fundamental issue. I do think at some point the president had to make a call, go or no go, because everything under the sun had been tried, and it was clear there wasn't going to be support. And then the Scott Brown election made it even harder. So there was only one way to get the bill through, which was to go back, have the House take the Senate bill, which was, as Henry can attest, no easy feat, because the Senate bill, the Senate version of the ACA and the House version of the ACA were very different. And probably the most remarkable.
Ours was better.
Yeah, it was, in many ways. The most remarkable room I ever sat in was a room where the president actually was negotiator in chief with the Democratic leaders from the House and the Democratic leaders from the Senate for about 8 or 9 days in a kind of conference committee reconciling these bills. So we knew what a great bill would look like. And then the Scott Brown election happened, and that was no longer a possibility. I think there are lots of issues, administrative issues, the debate about how much paperwork an employer should file, how you get to documentation how big the market should be. Whether you extend, I think it's a very legitimate discussion, whether you take the small market definition up to 100 people. I mean, those kinds of things need to be put on the table. Whether the Cadillac tax has the right target point. It was put out in 2018.
Do we have an environment those fixes can happen?
Well, that's the problem.
Not until 2017.
I think the problem, and it's important for people to understand, you hear this political messiness that happened, and I said it was miserably passed and messily written in my little blog. You left that out, I think.
Great snark.
But it's the point that they're making. I mean, obviously I have to put a little oomph into it, but the point is to make the way it passed, the bill's got good substance in it. I mean, it's
Good
fundamentally got
That's
good bones,
a-
good
It's
skeleton.
a good
Bill
house.
Frist tweets, by the way, and that's a tweetable moment.
Yeah.
Bill Frist says
Hey,
Obamacare has good substance
the
in
substance the substance of it, but
Right now, tweet it.
stop, let me talk.
Go
Is the problem is, and when we write this stuff, it has to be regulated. You have to fix it, not just in the technical fixes immediately, but it's an iterative process, and that's
Yes.
why our system of government is set up with a House and a Senate, Republicans and Democrats. You come together, you write a bill, you have these opportunities to fix it. The opportunity to fix anything or modify it was removed totally because of the way it was passed, because there was no Republican at the table at all. You could always buy somebody from the other side. I shouldn't say that. He was leader, I was leader,
But
and
we
for
want-
Medicare, I
but
know.
wait a minute, we wanted them at the table and they were
tell
at
me
the
somebody
table.
like Olympia Snow, who probably loves, who I love, but when she's in a,
Snow is buyable.
we shouldn't get
She
this
was
deep.
in the room for 3
But-
months.
but
Okay,
Senator,
but no,
she
the
was
point-
in
the
the
point is-
room and
so-
her ideas
but
are in this law.
Medicare was not,
500.
Medicare was not passed this way, Medicaid was not, Social Security was not, welfare reform was not, Obamacare was. The problem is, forget that.
Yeah.
The problem is, in the 5 years since then, if it's passed in a partisan way, it gets increasingly partisan when the American people don't like it because you're electing more and more people who basically say, it's not my bill. And the point is, a good bill, good substance, but you always have bad things in it. We haven't been able to fix the bad things over the last 5 years because you can't work together, because it wasn't put together in that spirit. I know you tried, and it didn't work. But if it had worked, these fixes would have come along. It'd be a much easier process, and we'd be
So we're
further
burning
along in
through
5
time
years.
here, but Tom and Henry, 1 minute each. What would be the 2 or 3 things on your what next agenda?
Steve,
Tom?
let me just say, I think we know we have 3 big problems. We have an access problem that we addressed. We have a cost problem that we've talked about. We have a real quality problem. This is legislation that is designed to address all 3, although the insurance side, the access, has gotten the bulk of the attention in the first 5 years.
A couple of other legs out.
Now we're going to move on to payment reform, to deal with cost, moving off of fee-for-service, coming up with innovative new ways to address cost and control it a
And
lot
the
more
value of what
effectively.
people are getting.
And then to delivery reform, to address quality. We still have a mess out there in measuring quality. We've got to figure out, if we're going to really talk about value, we've got to find ways to be able to measure quality to assess value. And that's something that you're going to see a lot more of as we go forward. We're going to have new tools to do that. There are 2 driving forces, policy and technology.
Right.
Policy and technology married together will help us address all of those challenges in the coming years.
Henry?
All of the things that Tom Daschle just outlined as to what we need to do, the administration can do without Congress. Because demonstration projects were written into the bill, different models could be tried, and so we're going to see things develop without Congress passing any new laws. And I think people are going to be cognizant of the fact that while some people would have said, if we're going to redo the health insurance in this country, why not take the model that most other countries have, which is a single payer, the Medicare model? The reason we didn't is because the president tried to get Republicans and Democrats to work together, so that he chose the Republican model that was put forward against the Clinton health care bill, which was private insurance companies competing with each other in a marketplace where the consumer can make a choice. So he made this as modest and bipartisan as he could. The Republicans chose, notwithstanding enormous efforts, not to be part of it. What can we change legislatively? I think we have to do what we can to get the states to pick up the Medicaid option. It's ridiculous that they haven't. It's free money that helps their health care providers, millions of people who are uninsured. It would help the economy of those states. And notwithstanding that, governors and legislators are saying, oh, we don't want that, because they're indifferent to the consequences of it. We need to get the Medicaid part fixed. Pharma got too good a deal in this bill, and we need to go back and correct some of those problems. But even after we correct those problems, the big cost driver that we're now facing is the rising cost of prescription drugs. We have to come to terms with that.
Right.
And I think we have a law in place that is a success, and we need to work around it. But I think the posturing politically will go on, but we can now work for bipartisan efforts in the future, where Congress will have a role, especially in the next couple of years where we have a Democratic president, and even after that, the next 4 years after that, when we have a Democratic president.
So Bill Frist has a quick tweet.
Yeah, just a quick thing.
Quick tweet.
The challenges ahead, which is really where we should be thinking, and I'm glad we started with this because now we have 4 days to really talk about the issues. Using Tom's construct, the access issues, Obamacare did a good job there, but we still have 10 million people covered. Now, we still have 20 million people without insurance. We have cost shifting until we have affordable access for them.
And most of those are Medicaid.
40% of the people who could be subsidized today are enrolled. 60% or about 50% can still be enrolled. So people like the Robert Wood Johnson Foundation, many private foundations, public foundations are together. We've got to get them enrolled in order to make the insurance markets work.
Right.
And so the access issue on the Medicaid side, hopefully removing this fog of uncertainty in the court system will allow our governors and governors and state legislatures to come before and go ahead and expand Medicaid up to 138, 140%. And on the cost side, the payment reforms, which Obamacare in part got going, but the private sector is really working with, ultimately will come down and look at the cost issue as well as the value issue, measuring quality as we come forward. Those are the challenges out there, which together, government and the private sector, if we work together in a bipartisan way, we can solve.
Somebody send that transcript down to Bobby Jindal.
But you're beginning
Yeah.
to hear, just a cautionary note on costs. And Henry's absolutely right. The act has administrative authority that's never been there. Huge, shifting the government trillion-dollar government payment system into quality, and they can do it without congressional permission. What Congress is beginning to do under the current leadership is start to flag areas where they're going to stop cost controls, protecting Medicare Advantage plans. There are 3 or 4 bills in now, protecting some drug pricing, which is being, so that's one of the things we're going to need to watch is when Congress says, no, you cannot accelerate cost measures based on quality, we're going to protect our constituents.
Do we have mics out in the audience? There we are, the lady with the white hat. I like that hat.
Thank you.
Hi. So we're like in the last 5 minutes. This was a robust panel. So short questions, we won't have lightning round answers. Yes.
The actual cost to avoid care is actually pretty low. This year it was $300 something. Apparently it's going up to $600 something, so that people can avoid having to enroll and pay the kinds of fees that it will take to actually enroll in insurance.
Right.
What was the thinking, those of you who were involved in it, about this question of avoidance, a penalty to avoid being insured?
Terrific question.
And how can we overcome
So
that?
let me give that to Nancy Ann, if you don't mind.
Yeah, well, we looked at that a number of different ways. In fact, the original 1-2 year ramp up was designed by Olympia Snowe, who you mentioned, Senator. So this was a bipartisan effort to figure out what would be the sweet spot. What's the amount that will get people to enroll but not be punitive? And in the first year or so, especially, they wanted it to be relatively small. It isn't just $600, by the way. It's a percentage of your income. So if you're a higher income person and you choose not to enroll in insurance, it will be a higher penalty. And the only real model we had, remember, was Romney Care, Governor Romney's reforms in Massachusetts. And those penalties were smaller than the ones in the law. And the thinking among all the economists who looked at this was that, number one, Americans obey the law. So if there is in the law a requirement that you either get insurance or pay this penalty, they will come in. And that what they've seen in Massachusetts is that eventually they come in.
Will it be
There's
higher
still
than
a 5%,
Bill,
5% of the population who
We'll
have
have to go
not.
up.
Are there many people, Bill, in the GOP that really recognize it was folks like John Chafee, Mitt Romney, Arnold Schwarzenegger, who were the real leaders on the mandate? Because there seems to be a lot of
Revisionist history.
Because Hillary Clinton hired John Chafee's person who helped write one of the first mandate pieces, before she did. So the Republicans owned this ground.
Oh, what round? Individual
Yeah.
What was
mandate?
the heritage?
I don't think the individual
Lawyer
mandates.
mandate.
Yeah.
It's this individual mandate came about during the
I think the question
10 years
is
after.
this enough? Basically, most people think you need to get everybody to have some kind of insurance. We have failed. We still got 20 million people out there who aren't covered. Is this individual mandate high enough to force people in? Is it,
Well,
Kath?
and the important thing is, are the insurance markets robust enough? That's the issue.
Yeah.
Do we have a mic over here for this gentleman? We've got somebody
Here it
racing
comes.
towards
Here.
you. Here we go.
In terms of what's next, we know that a lot of what's driving the conversation around improving value, decreasing costs, and improving quality are these upstream social determinants of health. And I'm curious at the federal and the state level, what is necessary in terms of opportunities to address those social determinants from the private payer side and the federal government side? How do we start to look at ways to have healthcare systems do a better job by addressing upstream factors?
Tom?
Well, I think that's such an important question, and I think we've got to look beyond our health sector to do this. We've got to look at nutrition, and there is a good deal of effort now underway to link nutrition and health in a much more constructive way, especially for younger generations.
And
That's
the Affordable
really
Care Act had menu labeling. I
A
don't
little
know
bit louder, Nancy Ann.
The Affordable Care Act had the requirement that chain restaurants label menus with calorie counts
Right.
and
But
A whole section on
it's also
prevention.
access
Yeah,
to
whole
these
prevention.
opportunities. Too many people still don't have access to good nutrition and opportunities to learn about nutrition and health. And I think we have to do a better job in the schools in order to create that new environment.
I know
We're
the
gonna make this
Surgeon
work.
General is here. So wave to everybody. You're dressed in a uniform. I feel so guilty. You dressed like that in Aspen. That's Vivek Murthy. He's really cool. And we're going to be talking about this in the closing session of Spotlight Health. Kathleen?
Beyond, I think there are lots of social determinants, but the two that underride most chronic conditions are smoking and obesity. And I don't think there's any question that in this administration, there's been a doubling down on both of those. We've talked about some of the nutrition. Certainly, Michelle Obama has changed the conversation, not only in this country, but around the world. People are beginning to think differently. But smoking, thanks to the Congress, FDA finally has nicotine control. They can go after the off-sites. They're dealing with the deeming rule, which would take in all tobacco products, and driving our smoking rates down can have a huge impact.
Henry?
I just want to make one observation. When, after World War II, we had health insurance, people got it through their jobs. The group that didn't have health insurance were the people who didn't have their jobs when they retired, the seniors. That was the fastest growing area of poverty. So we passed Medicare. When we passed Medicare, there was a provision in it that said, this law is not intended to change the way medicine is practiced. This was something put in to satisfy the AMA. Now look at where we are. The Affordable Care Act was intended to change the practice of medicine in this country. And we're using Medicare, because what Medicare does is copied by other private insurers. We're trying to give the incentive for the whole healthcare system to figure out new ways to provide care efficiently for people with chronic conditions. They shouldn't have to go from one provider to another. There ought to be some cohesive ways for them to get the care they need. So we are putting in place an effort for the government to give the right incentives. It's going to come from the private sector within certain bounds. They can't sell a shoddy insurance policy anymore. They've got to have certain minimum standards, but ACOs or group payments or hospital-based innovations, all these things are happening right now. And we're living in a very exciting time.
Bill.
And prevention is very much a part of this.
Thank you. Bill, I'm going to give you the last word of our session. And I'm going to ask you, if we hadn't had the Supreme Court decision, had our great program on big issues of the 114th Congress and health proceeded and not been hijacked by events, what would have been the takeaway zinger you would have left us with?
I think for this session today, kind of comes back to the last question. If you look at health, not healthcare, health system, government stuff, and if you look at the health of Nashville, the health of your communities, which is what you should be thinking when you leave here, what are you going to do? The social determinants of health, this last question over here, are 5% environment, 15% socioeconomic of health, 30% genetic, 40% behavior, smoking, seat belts, and the like, and only 15% government, Affordable Care Act, how good a Dr. Bill Frist is, what kind of legislation it is. It's important, but if we want to have an impact on health, what we all need to do is leave this conference, go back, go to the Robert Wood Johnson Foundation website, see what your county is in terms of its population health with 22 measures, the true health, the burden of disease, the burden of well-being, and say, where are we? And then challenge your local community leaders, not your doctors and not your politicians, to come together in the aggregate and say, we want to go from 15th in the state to first in the state. That is the way we're going to address it. It's not going to be through just politics or Affordable Care Act or better doctors or better hospitals. That's good, but that's only 15% of the gist.
Ladies and gentlemen, please help me in thanking Henry Waxman, Tom Daschle, Nancy N. DeParle, Bill Frist, and Kathleen Sebelius. Thank you so much for joining us for this morning session.
Thank you, Steve.